Hello and welcome to PCOM Perspectives. I'm your host, Dr. Jay Feldstein, and today we're talking with Dr. Ann Contrucci, Assistant Professor of Pediatrics at PCOM South Georgia. Dr. Contrucci is a board-certified pediatrician and has been practicing medicine for more than 25 years. Throughout her career, Dr. Contrucci has worked in pediatric emergency medicine in the suburbs and inner city, as well as practiced primary pediatric care in suburban and rural settings. In private practice, Dr. Contrucci focused much of her time on patients with mental health issues. Dr. Contrucci is joining us today to discuss emotional and mental well-being in medical students. The topic is timely as a new academic year brings on new rhythms, especially for first-year medical students. These can include a demanding and stress-inducing class schedule and many other factors, like moving away from families, friends, and hometowns, learning new study habits, minimizing social activities, and facing financial difficulties. Today, we will talk about how we, as a college and as physicians, can destigmatize and address mental health. Welcome, Dr. Contrucci.
Thanks so much, Dr. Feldstein. I'm so happy to be here to talk about this topic.
Well, and we're glad you're here too. So I got a couple of questions for you.
Okay.
Why is it important to address the topic of mental health, especially among medical students?
I think the biggest take home there is, first of all, I like to always say, mental health is health. It's not mental health, it's health. We don't say physical health, right? So mental health is health. So this is something that affects everybody. You can't have mental health without physical health or lack thereof. They are completely intertwined. So I think the most important thing the reason to address this topic is because it's something that affects everybody. I mean, a few statistics of more than 20% of Americans are affected by some sort of mental health illness, or as I like to call it, a brain-based disease or neurobiologic disease. So that's a huge percentage. And we know that when we talk about medical students, that those statistics are even higher. We know that medical students have, potentially at least 15 to 30% higher than the general population, things like depression, especially. We know that suicide is higher amongst physicians than the general population. In males, it's higher, it's 40% higher. Male doctors, it's 40% higher than the general male population and 30% higher in female doctors than in the general female population. So this is something that we must discuss and we must do something about. And I think especially for our medical students, you touched on it, they are starting, especially these first years. I can remember way back in the day, as I'm sure you can, Dr. Feldstein, way back in the day, I was terrified as a first-year medical student. You go from being, top of the top in your college classes, et cetera, et cetera. Otherwise, how would you have gotten into medical school? And now you're surrounded by everybody's kind of like that. There's the competition factor. There's the temperament factor. There's all the things you mentioned, moving away from home, having much more stringent studying that needs to be done, much more knowledge that needs to be obtained, much more the volume itself, the financial hardships, all of that. So I think for medical students especially, this is a topic that we just cannot ignore and must continue to talk about and not just talk about, but do something about it.
So what can students do to take care of their mental health?
I love that question. I think that one thing that PCOM does is, we've got resources available, which is wonderful. They are able to get counseling free of charge on all 3 campuses. We've got different crisis lines, et cetera, that are made available to them. I think the most important thing is it's kind of like what I tell my patients and their families whenever we are talking about mental health and health. Is you've got to have the 4 pillars, and the 4 pillars include, you've got to have, they're simple but not easy. You've got to have proper sleep, which what medical student gets proper sleep, please? Did you ever get proper sleep when you were a medical student? I sure did. But you've got to try to have some kind of schedule of sleep. We know that sleep deprivation leads to all kinds of things that are brain-based. Foggy feeling brain, can't focus, can't have attention, you feel depressed, you feel anxious, all that kind of stuff. So you got to have sleep. You got to have nutrition. What did we do as medical students? I sat in my module and I used to eat Teddy Grahams was my big snack. And I would eat like boxes of Teddy Grahams. And I have no problem with students eating Teddy Grahams, eat them, but make sure you got some protein in there somewhere too. So you've got to have some kind of proper nutrition. The third thing is you've got to have some kind of exercise. And it doesn't mean you have to go to the gym every day. Get outside and walk. We know that nature does wonders for our brains and for our calming and for centering ourselves and grounding ourselves. And then the fourth thing is the social support. And I kind of include social support to mean, your colleagues, your classmates. I mean, these are people that are going to be your colleagues for your career, right? So learning to trust them and to rely on them, and then family and friends that are outside of medicine. But honestly, some of my best friends still to this day are from med school and residency, and I might not talk to them for 10 years. And as soon as we do, it's like we never skipped a beat. So I think the social support, and then along with that is watching your social media and screen time kind of thing, because people get really, really wrapped up in that. And that really, it has been shown to affect your mental well-being so very much. So those are kind of things that I start with the medical students.
So how are our students trained to address mental health in their future careers?
As an entire system of medicine, not PCOM, not any one particular medical school, I think we do a pretty bad job of it, to be quite frank. I think that there's so many things that have to be learned in medical school that this has kind of been pushed to the side, so to speak. I don't think it's purposeful. I think it's something that just over the years has just not gotten a lot of attention. We talk about boards. There's not a lot on the boards about behavioral sciences, for instance. But I think that as a complete medical system, that's from, medical schools, residencies, hospitals in general, if you work for a hospital, private practices. So I think our entire medical system has fallen down on this, and especially specifically teaching our students and our residents about the interplay between your brain health and the rest of your health. Because the last time I checked, your brain is actually an organ too. So I feel like one of the things that's exciting is at PCOM, I know that we've got the wellness that the students do. And I love that, they're learning about their own wellness because, physician heal thyself. You can't take care of anybody else till you know how to take care of yourself. I'm involved with the CRIBS courses and the Complex Readiness Program. And one of the big things I like to talk to the students about is their self-care. And how are you doing with your self-care? And we talk about mindfulness and all these things that used to be sort of considered, as I say, woo-woo. They're really not woo-woo. The neuroscience is there. So I think that's one of the things that we need to incorporate more of that into the curriculum. I was able to do a couple of mental health lectures specific to pediatric and adolescents in our life stages course, which has now been incorporated into the curriculum in other ways, but I was able to do that. I was able to assist Dr. Langenau in his fourth year medical student behavioral health elective. And one of the things we talked about was eating disorders. And every single student in the elective said, we have never ever had a lecture on eating disorders. And eating disorders affect 30 million Americans. So I think that's what we need to do. We need to really look very closely and critically at curriculums across the board in all medical schools and residency curriculums, because these are things that just have to be included. It's health. Mental health is health.
Well, I couldn't agree with you more. So I know you've got a couple questions for me as well.
I do.
So this time, feel free to ask.
How do you feel that physicians can best destigmatize and normalize the conversation around mental health, both with our own colleagues, other attending physicians, other faculty, and with our students and with our patients?
I think one, as a holistic entity in the osteopathic profession, we take the approach that as you said, health is health. You can't separate out behavioral from physical. They are one and the same. They're totally integrated. And the system over the last 50 to 75 years has done everything it can to separate the two. from insurance companies who do behavioral health carve-outs, to just think about when you were in medical school and I was in medical school, anything was behavioral health oriented, went to the psychiatrist, right? And our training, you were usually, you were in a mental hospital, seeing the worst of the worst in terms of burnout, schizophrenics, people that had to be institutionalized. So you never really saw behavioral health in your training as mainstream. And, anything came up in a private practice office, it went right to the psychiatrist, usually for medication. So we need to integrate it as part of primary care. So it's just part of the conversation. You check somebody's blood pressure, you check their mental health status. Yeah, so it's part of the normal conversation that you normalize it, not by putting it somewhere off in a corner or thinking it needs to be handled by a specialist. By everyday conversation, depression screening, 3 questions. You don't have to sit there and say, I'm now going to do a depression screen. Just like you'd ask somebody, how are they feeling? How are they sleeping? What's their eating habits? Everything you talked about, the pillars of health, affect both physical and behavioral health. And the way to destigmatize it is what we're trying to do as a society. I mean, Simone Biles has probably done more for behavioral health in the last week than anybody's done in the last 15 years. And of human performance. And I think we need to do a better job of integrating it into the curriculum the best we can. As you know, whenever we put something in, what do we take out? Because there's a finite amount of material that people can learn. And it's not even just the more significant mental health conditions, whether it's schizophrenia, bipolar disorder, but it's just normal everyday anxiety and depression. And there's nothing abnormal about being anxious or depressed. I mean, it's people that are happy 100% of the time, I worry about those people.
I agree.
And because you're feeling depressed doesn't necessarily mean you have clinical depression.
Right.
But you just need to be able to talk about it in a safe environment so, people don't feel judged. And we don't judge people because they have high blood pressure or type 2 diabetes. We shouldn't judge people because they're depressed or they're anxious. Overall societal approach from education, from practicing physicians, and from the way healthcare is reimbursed in general. We try in our primary care clinics, we have a behavioral health specialist embedded in the healthcare centers. So if a primary care doctor feels someone's got a behavioral health issue and needs to be addressed, they bring them in the room. There's no try and make an appointment with a behavioral health specialist, which takes 6 to 12 weeks. And especially, this, how long it takes to see a child psychiatrist.
We don't even have enough. I did a talk on that. We are so underserved when it comes to child psychiatry. So exactly. So if somebody gets out of the hospital for a serious episode of depression and they actually had to be admitted. Well, if you just had a heart attack, there's no question, and you've got a stent placed, or you just had a cabbage done, there's no question you have an aftercare plan. You're going to start your cardiac rehab, blah, 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 blah. Somebody gets out of the hospital after a serious depression episode or perhaps a suicide attempt. Well, see a psychiatrist. That's the aftercare plan. Well, good luck with that, because you're going to see a psychiatrist, if you're lucky, maybe in 6 weeks. And an adolescent one, a child one, maybe a couple of months. 2 to 3 months. That's your aftercare plan. We don't do that for other things. And you are so spot on about the non-judgment. It's, one of the things I think that we can do as faculty too, if we're teaching, for instance, in PCS, in the primary care skills, one of the things I really talk about when I'm talking about, as you're going through your SOAP note and you're taking a history and physical, when you're asking past medical history, you ask if there's any psychiatric history. And you don't say, do you have any psychiatric history? Just like you say, have you had diabetes? Do you have hypertension? Have you ever been diagnosed with depression? I mean, it's just part of the normal conversation. Family history. Is there diabetes in your family? Is there anyone in the family that has been diagnosed with anxiety or bipolar? I mean, you just make it a part of the normal conversation. You are completely spot on with that.
I think what else we're trying to do is we're trying to actually train faculty, especially in the first 2 years, to be able to help recognize students that are in trouble, or if students come up to them after class, how to direct them appropriately. It's actually in our strategic plan through student affairs to come up with, mental health teams. We're doing it in terms of peer-to-peer with student clubs and student wellness initiatives. So we take this very seriously because you have to.
I love that. And since I'm fairly new to PCOM, and I love the idea of peer-led types of activities and groups. We know that they work. We know that faculty-led types things work. I was involved in creating a peer-led support group for physicians who were in the middle of a malpractice lawsuit. And we had a peer support group that we trained, and those kind of things work. And I love the fact that PCOM does take these things seriously. We have all these mentoring kind of things that faculty do, whether it's formal or informal. And I think you're 100% just right on target, that we have to do these things. We have to be able to recognize it. We have to be able to normalize it. We have to be able to say, hey, come on, let's go talk about this. And let me see where we can get you some help. Just like if they came in and they, were diabetic or something. I mean, it's not any different. And that's what we have to keep saying. And that's why I like to talk about it. And I talk about it with students. I've had so many students come up to me after some of my lectures and say, I had a problem with this, and this, or I was in treatment for the, just totally open and vulnerable. And that's really what has to happen.
Well, I think we both agree on that.
I think you're right. How do you, as the president of PCOM, what a responsibility, how many things do you have going on, how, at one time, blah, blah, blah. How do you take care of your own mental health? What do you do for it?
Well, I try and do the pillars that you talked about. I like to walk. That's my favorite exercise. It also clears my head. And try and eat right, and try and get enough sleep. And I also do podcasts for my mental health. I like to keep work fun whenever possible. And I really enjoy doing these podcasts. And it helps my mental health.
I love it.
And I think, this year, especially during COVID, which was incredibly stressful for everyone, it was more important for us to be able to somehow, get the silver lining through this. And I think these podcasts help me communicate and stay in touch with our general community as a whole, both student, faculty, and alumni. And I just really enjoy doing them. I enjoy having conversations with different faculty members across all campuses. And I just, I enjoy it. So I think, getting enjoyment out of your work, which is something that we all do more than anything. We work more than anything. We're supposed to sleep 8 hours a day. We work closer to 8 to 10 hours a day. It's really helpful to enjoy your work. And also, your relationships with your loved ones and family and friends. That's your support system.
The support, you mentioned COVID, and that was something I was going to mention too. You'd mentioned Simone Biles, and man, she's a rock star. She truly is the GOAT. Just the fact what she did, coming out and saying, can't do it, going to take care of me. And then COVID totally brought to light so much of what a crisis we have in brain health across this country. We have a huge crisis. It's been there for years. There's plenty of people that are screaming about it, but it hasn't been, as I call it, the cool kids disease. And it's time for it to be the cool kids issue. It's time for it to be the cool kids issue, because it really affects everybody. And I think COVID, you mentioned social support and how you utilize that as your touch point for your well-being. And it's so true. What did COVID do except show us that we really are connected, and isolation is really, really bad. There's a great book that the former Surgeon General, Vivek Murthy, I don't know if you read it or not. I believe it's called Together. It's awesome. And it talks all about the isolation, what it does to, guess what? The rest of your health. And what does loneliness and a lack of social support do to, the rest of your health? So again, coming back to that integration, I love what you said about that. And just, if you're able to take care of it, and none of us are perfect at it. I'm not, I embark on mindfulness stuff all the time, and then I'll do good for a while. And then I'm like, okay, I just can't do this right now. So it's about just continuing to have the conversation and be aware and to talk about it. Anybody and everybody will talk about somebody's heart disease or their cancer diagnosis, and they'll have overwhelming support. We need to have the same thing for our brains when our brains are sick. And even when our brains aren't sick, but when, like you said, everybody has a little bit of anxiety. When I talk to students about test anxiety, I'm like, if you have no test anxiety, I'm a little worried about you. If you're going into your boards and you have absolutely no anxiety, I'm a little concerned. So a little bit's okay. It's when we cross over, when there are red flags that we need to be aware of and do something about.
Well, I'd like to thank you, Dr. Contrucci, for joining us today. As we have seen firsthand during the COVID-19 pandemic, it's important for all of us to take care of ourselves first. The PCOM community has a responsibility, especially to our students, to ensure that they have the tools necessary to succeed, whether that be through counseling, wellness courses, a mentor to support them, or just a simple reminder to take time for themselves. To listen to past episodes of this podcast and become a subscriber, visit our SoundCloud page or find us on iTunes by searching Philadelphia College of Osteopathic Medicine. I'm Jay Feldstein, and this has been PCOM Perspectives.